I was honestly quite surprised to be asked the question. I think I never really thought of myself as a leader. So to try and define what my best experiences were was a tricky one. And it just made me think about the presentation that Drew Dudley did on TED Talks around how sometimes we think of leadership as this massive, huge thing that kind of takes years of experience and all this growth, and actually he boiled it down and said it's more about the lollipop moments. And I think for me that has to be my best experience as a leader, and watching the people that I lead become the best versions of themselves creates a happiness and contentness in me, knowing that even when I'm not there, they will continue doing the work that I started and the work that they will continue to develop. I think the UK has a quite interesting context in how it sits alongside and works symbiotically with the National Health Service, but in some ways it doesn't at all. And I think one of the biggest things is our funding in the UK. And because of our funding, it's really made us focus on what matters and starting to grapple with the question that while in palliative care we would like everyone to have everything, actually we have to consider the finite resources that we have, and perhaps good enough is good enough, and that we should be driving more towards something for everyone. And I think trying to have that culture change around we can't provide everything for everyone, but that what we do provide is good enough, is a real challenge. And that's what we've been kind of grappling with within that kind of financial context, and it's what's drawn us to think about that more critically. I have to say my organisation. I work for St Michael's Hospice and Heriot Hospice in the north of England, and our leadership team and chief executive there have afforded me the ability to be able to travel, to be able to learn, to be able to research, but also an environment into which we can add ideas, we can add thoughts, we can challenge the system and the status quo.